Well, our top focus on the show now is India is seeing a rise in COVID cases. Once again, the good news is the vaccination drive will finally open up for more people from Monday. That's when the next phase begins. And in this phase from March, anyone above the age of 60 or above 45 years and with existing illnesses that makes them more vulnerable to COVID will be allowed to sign up to receive the vaccines. And this time it will be available at government as well as private hospitals. Doses at the government centers will be free. The private hospitals will be allowed to charge for them. And NDTV has learned that it's expected to cost around 300 rupees per dose, but we're still waiting for a confirmation on that. Registration is expected to be through the Arogya Setu and CoWIN apps using any government-approved identification. Again, more details are required on the registration as well. And once people are registered, they can, go to one of the vaccine centers near them and get vaccinated, get inoculated. Well, to talk more about this, we're joined by Dr. Sandeep Budhiraja, Group Medical Director, Max Healthcare. Thank you so much, Dr. Budhiraja, for joining us on the show. So very exciting that, this demand that had been made by many of you, many experts about involving the private sector as well in this entire vaccination drive, so we can really speed it up. Has been, the government there now taking that step in the next phase. What do we know so far about how it's going to be, how the registration and the entire process is going to be?
So I think to start with, it's really a welcome move by the government, and we've been waiting for this day. Finally, it seems to be starting on 1st March. Now, as far as what information do we have, it is again, we haven't really heard of the finer details about how the registration process has to happen, how the vaccine procurement will happen, and what the charges would be. So I think we are expecting that announcement to come anytime if the vaccination drive has to start from 1st of March. But at our end, at the end of private healthcare partners who are pitching in for partnering with government as far as vaccination is concerned, in terms of infrastructure and manpower, we are all ready to handle. So we have already been doing vaccination drive over the last 6 weeks. If we take example at Max Healthcare itself, we have vaccinated over 20,000 people since the vaccine drive started mid-January. With it's a very safe vaccine. We have had very few, or less than 100 very minor side effects. All the people, not patients, have been fine, and many have received their second doses. So I think from the experience one has gathered, and this is not only a local experience, I think world over, we know that vaccine is effective, vaccine is safe, though there is still an issue of vaccine hesitancy, and not only amongst public, but we have seen that happening in healthcare workers also. But I think all these barriers need to be now broken, and we must march ahead. The window of opportunity for us in our country is very, very small, and we just can't afford to lose any more time.
Absolutely. There's a need to really, quicken the pace of the vaccination. In fact, if we take a look at the comparative figures of other countries, Israel, of course, has been doing its vaccines at a very fast pace, and they're way ahead of everybody. Then you have, the UAE, the US, etc. India so far has vaccinated 0.86 people per 100 people. So we really need to pick up that pace, especially given that the COVID numbers were fairly down recently. Of course, now the fears over them rising. We'll talk about that in just a second. But the need to pick up the pace of vaccination, especially during this period.
That's right. The reasons why the numbers will rise and are rising is probably not only, we are talking a lot about mutant strains, but I think more than the mutant strains, it is to do with the public behavior. So we need to understand that there are only two things which can presently control corona. Corona is not going anywhere. The virus is going to be staying here. Only thing is people behaviors by which the transmission cycle can be curtailed is by masking and social distancing. And this is something which we need to continue for good many months, maybe a year or more. Vaccine is the only definitive answer to reach that magical figure of 80% of population getting herd, to reach a level of herd immunity where the transmission cycle of the virus can actually be broken. So I think the most important focus at this stage, and India seems to be in a lucky position that we have had the least numbers or the lowest numbers in the last few weeks. And, this opportunity may be very, very short lasting. And so the larger the number of people we can vaccinate in the coming few weeks, that also the government has done the right thing by including people above 60 and more so above 45 with risk factors, comorbidities, because this is the most vulnerable population. And if we can actually prevent, let me tell you, we talk about vaccine efficacy. Vaccine efficacy is not the thing to be discussed because it is going to prevent the major severe disease and hospitalizations, and that's what the concern is. Even after taking the vaccination, if a person gets a mild disease or asymptomatic disease, that really doesn't matter.
Right.
So I think, yeah, so most important focus now should be to make people understand that please come forward and take the vaccine. And now with the option being available in government and private, I think the waiting times and all those difficulties can be cut short, and one can get the vaccination done for all the family members who fit into that eligible age group.
Right. And Dr. Budhiraja, you, of course, we're in the national capital. It's very different over here. What concerns do you have about the vaccination drive in other parts, in rural parts, in other parts of the country? And the fact that, there's been a lot of emphasis on technology or dependence, with the CoWIN app and the Arogya Setu app. But perhaps now for the registration, we're still waiting for those details. But, some people will not be so technically savvy, and they will need more assistance in coming and registering themselves and getting the vaccine.
Yeah, in fact, I've been sort of criticized at times by making comment, which I'm going to make again. Two things. One is that, as we know, that the window of opportunity for our country is very small. So I don't think we should delay the mass vaccination campaign just to get our IT platform to the perfection. Whatever it is, I think seems to be working, may not be up to its full optimal level, but we should create a simultaneous parallel system of registering people, which could be walk-in manual registration. They carry their government approved ID cards. We maintain some registers as required by the government, and later on the data can be converted into the IT platform. But let's not, I would use the word waste time perfecting the system. That's the point number one. Point number two is, like right now, the number of vaccination centers seem to have been increased from initial 11,000 to 20,000 now, of which 20,000 are going to be in private. I think this number is still way short of what our country needs. And I'm told the final number will be somewhere around 100,000 vaccination centers. But it's how soon we can escalate those numbers from 10 to 30,000 to 1 lakh vaccination centers. I think the basic crux to the whole implementation of the vaccination program. Now to do that, what NHS has done presently is that they have rolled out the ability to vaccinations at the level of GP clinic. Now, when I say that, a lot of critics are talking about the need to observe the patients for side effects. Yes, we need to do that. We know that vaccines are safe. Major adverse events, which is anaphylaxis, does happen, can happen with any vaccine. And we need to monitor that. So as long as facilities are created where we can keep the person who's got vaccinated for half an hour, observe closely, have that AEFI kit, which has adrenaline, which can be injected to people who get anaphylaxis, and people are properly trained. And there's a backup mechanism so that if there's a small center where vaccination is being done and the patient now needs to be shifted to a hospital, so there are robust ambulance services and a robust mechanism to give end-to-end cover. I think we must rapidly expand our services and involve the smaller players also to vaccinate. That's the only way the country can actually then tide over this period of pandemic.
Absolutely. There's a need to speed it up, and we're waiting for those details, to be available about how the entire process will take place in this next phase. Thank you so much, Dr. Budhiraja, for speaking to us here at NDTV.
Thank you.
Well, let's now focus on the United States, where 500,000 Americans are dead as a result of the coronavirus that first hit the country just a little more than a year ago. It's a very sad milestone that's left families mourning nationwide. The vaccination drive has picked up with over 19% to 20% of the total population vaccinated so far. And the good news is there may be a third vaccine soon available in the United States, with the FDA declaring that Johnson & Johnson vaccine is safe and effective. Well, to talk more about the United States, we're now joined by Dr. Fahim Yunus, Chief of Infectious Disease, University of Maryland, Upper Chesapeake Health. Thank you so much, Dr. Yunus, for joining us on the show again. And first and foremost, it's been a very sad milestone for the U.S., crossing 500,000 deaths. It's something unthinkable when the pandemic first hit the U.S. How are things currently?
I think situation is getting better, and it's terrible because we believe much of this was preventable. And when people will look back at history, they'll realize that when we don't work together, this is what collateral damage looks like. I mean, our government, our scientific agencies, our pharmaceuticals, they didn't work together to some degree. And now we are seeing that alignment of the messaging. And the key word really is messaging. The government's message about masks and precautions and social distancing is fully aligned with the scientific message. And now there is enough funding for all the vaccination campaign. So clearly we are seeing the pandemic slowing down for multiple reasons, but I believe good days are ahead.
Right, Doctor, and experts have also said that coronavirus variants will likely drive a new wave of transmission in the US come spring. So really a race between the vaccine and the variants.
Right. I think it's unknown. Nobody knows for sure. And I think we need to respect the virus and not fear the virus. Because even where the variants have gone rampant, like UK or South Africa, they have been able to control that outbreak largely just based on social distancing and main similar precautions. They don't have any new fancy vaccines. They don't have any secret treatments. But if you look at their curve right now, they've pretty much crushed this pandemic again, which is very encouraging. So I keep telling people it's a big unknown because we have not done enough genetic sequencing. I don't know whether these variants were here 6 months ago and have become a part of our endemic flora by now. I don't know if it's 2% and it's going to come later. There are a lot of questions and unknowns, but all I tell the average person shouldn't be worried about it. The reason I say this, the moment people hear the word variant, they think of a man turning into a fly, and in real life that doesn't happen. It's not Hollywood.
Now, if we talk about the vaccines, while they protect you from getting coronavirus and if not from getting it, at least getting not such a serious illness from coronavirus, what is the view on transmission of the virus by those who've been vaccinated? Because that's something that's still being discussed by all of you.
I think vaccines are excellent. I think I'm disappointed at some of the experts who bring certain things out in the media that belong in medical grand rounds. There's a lot that we as physicians have to discuss and debate, but that shouldn't be out in the media in front of the people. Just imagine if you were in a plane and the plane was going through a storm and you were sitting in the cockpit of that plane. You'll probably freak out just by the number of alarms and bells going on. But the pilot, for him, those alarms are important for him to navigate the plane. So I think it's important for us to tell people that, look, the transmission will be lower with all of these vaccines. We all know that. How much lower? We don't know that number. But the message should be vaccinate, vaccinate, vaccinate. That's what's in your control. Forget about those things which are more like theoretical conversations and scientific conversations, because they take it away. They deflate. When we say, well, we don't know about a transmission, you'll still have to wear a mask. You'll still have to do everything. If I'm an average guy, I really say, oh, why the heck I need a vaccine then, right? And we don't want that. So I hope I answered your question. Transmission will be lower, much lower. We just don't know the number yet.
Right, you're absolutely right. In this time of pandemic, with everybody so interested and focused on coronavirus, that each and every detail is something that we go into. But some good news in the US with another vaccine in sight, Johnson & Johnson vaccine. Are you hopeful of getting this one-shot vaccine soon there?
Sure. I think Johnson & Johnson is a great addition because it's an effective vaccine. When you look at prevention of death, it is just as good as Moderna and Pfizer. It's a one-shot vaccine in most cases, can be moved around without any ultra cold chain, will really flood the market. And we're looking forward to a day not so far in the future, at least in US, where the supply will be much more than the demand. And I think why I'm interested in that, because that then allows for more equitable vaccine distribution. No country has any incentive in hoarding the shots. Then hopefully there will be more sharing and more people will get vaccinated. So not just Johnson & Johnson. If you look at the recent Lancet paper, there are about 26 vaccines in the pipeline. Just think about that. 26. And if even 12 of them became globally approved, that will be enough for us to win against this pandemic.
All right. Yes, of course, more vaccines available. We'll be able to see the end of this pandemic, the back of it. In fact, Dr. Fauci recently said that America would probably need to remain masked up till 2022. What's your view?
I think it'll be different for different countries. Again, this is where the question is how well a country can come together. Just like this virus comes together against us. If you are in New Zealand, your answer is yes today. You're not wearing a mask, right? If you're in Vietnam, your answer was months ago, you're not wearing a mask. Similarly, it's going to be different for different countries. How well you get vaccinated. If 70 or 80% of your population is vaccinated, trust me, I don't see any reason for wearing the mask. That country will win. So I keep bringing it back. The message right now is, what is it that you can control? Vaccination number. Why is that not going up? Either because supply isn't there or there is hesitancy. Work on those 2 points. Increase the supply, answer people's questions about vaccination hesitancy, get to a 70, 80%. You'll have all your wishes fulfilled. The end of the pandemic, no more masks, and whatever else is in your heart.
All right. Thank you so much, Dr. Yunus, for speaking to us here at NDTV once again. With that, time for us to slip into a short break. Coming up on the other side, we'll get you the latest from Germany, where they're fearing a third wave. Welcome back. Well, let's now focus on Germany. And German Chancellor Angela Merkel said that Germany will need to reopen cautiously and step by step in order to avoid a sudden return to lockdown if COVID infections pick up. Many schools in Germany reopen on Monday, but officials say infection rates remain worryingly high. Well, to talk more about this, we're joined by Thomas Sparrow from DW. He joins us from Berlin. Now, Thomas, there are discussions in various European countries about the reopening of schools. What's it like so far in Germany?
Daycare centers, elementary schools in most German regions reopened this week, almost 2 months after they had to close because of high coronavirus numbers here in Germany. The reopening does not, however, mean that schools are going back to normal. Some schools have split the classes into smaller groups, for example, whereas others are allowing pupils to go to school only on certain days. Those who are in favor of this move say it is important for their education and well-being, as well as for their parents after months of working from home and helping them also with virtual learning. Those who, on the other hand, are skeptical of the decision to reopen schools say it could have a negative impact on the overall coronavirus situation in the country, which has generally improved in the last few weeks as a result of the strict restrictions that have been in place since December.
So with schools opening now, does this mean that teachers are getting vaccinated quicker than other groups? How is Germany handling this?
Well, since it can be hard to ensure social distancing with young children, the idea is for teachers to get priority access to a vaccine, in particular the AstraZeneca vaccine, which in Germany is only being used for people of working age, and in some cases it has been met with public resistance, as anecdotal reports have surfaced suggesting that it may cause stronger side effects or it's not as effective as the other 2 vaccines that have been approved at a European level. Only a small part of AstraZeneca vaccines that have actually been delivered to Germany have been used. The German government, however, has launched a public relations push to reassure citizens that it works, stressing that it's highly effective and it's safe. So far, Germany has administered over 5 million doses of the different vaccines, including that of AstraZeneca. But Germany is well behind other countries like the US, Britain or Israel.
So what will be the next steps in Germany's plan to reopen?
The German Chancellor Angela Merkel has said the loosening of restrictions should be carried out in 3 stages, obviously depending on whether numbers continue to go down and remain down for some time. Those stages are personal contacts, so in other words, how many people can meet between households, further decisions on schools and sports, and then the reopening of restaurants and cultural institutions. But the Chancellor has also warned against a hasty reopening, and she has said that the country should reopen cautiously, in particular because of concerns that Germany might already be in a third wave caused in part by the more contagious coronavirus variants that are certainly becoming more common in the country. A decision on those next steps is expected at the beginning of March, when the Chancellor and regional leaders will agree on the way forward.
All right, that's a tricky question everyone's dealing with. Thank you so much, Thomas Sparrow, for joining us with those details about the situation in Germany. And that's all the time we have on the show today. Thanks so much for watching. Goodbye.